Hello, I'm Dr. Paul Smolin, also known as Doc Smo. I'm the founder of DocSmo.com and a practicing pediatrician for the past 31 years to date. I created DocSmo.com to be an educational resource for parents. Portable, practical pediatrics for busy, digitally savvy parents. From the crib to the country club, as we like to say. Thank you for joining me today. Now today I'm going to show you some splinting skills you can use the moment your child sustains an injury. Splinting is an important aspect of injury care because it helps limit the swelling, it gives some pain relief, and it often prevents further injury by stabilizing the injured site. I think it's often better than a cast because it's removable and your child can keep their range of motion and strength while their injury heals. Along with ice, a little bit of compression, and some elevation, splinting is often all that is needed for many sprains. So let's examine some easy splints for some common kid injuries, shall we? Okay, well here's something I see frequently. A sore shoulder or a sore elbow from falls and crashes. This is usually in older children who are very active. So your child has a crash or a fall and they're complaining of either their elbow hurting or their shoulder hurting. What do? Well, you do what you normally do. You stop and examine them. Make sure that there's no long bone fractures. Make sure that there's no twisting or deformity of their arm. Make sure their hand is warm and not cold. That cold is bad. Make sure they have good circulation in their fingers. Push down, it turns white, let up. Within 2 seconds, it should turn pink again. Remember, the hallmark of a fracture is swelling and point tenderness. So let's say your child fell and they're complaining of a lot of pain in their humerus, in their upper arm. And you see there's some swelling and they're very tender here. Emergency. You need to go to the emergency room or call 911. Same thing with the forearm. They probably have a broken arm. And these can be quite serious. But assuming that you think this is more of a sprain and bruising of either the shoulder or the elbow, and you've done your examination, then it's time to do the regular old sprain care. We get out some ice. I like this chemical ice. You just hit it, turns cold. You can put this wherever your child is hurting. Okay? Once we've done that, we want to immobilize this shoulder and this elbow. So an easy way to do that is with a sling. You can get these at the drugstore. They're very cheap. Okay? You might have one around the house. You just slide your hand in there of your child, slip this over their shoulder, adjust it so that the strap is taking the weight of his arm. And voila, you have immobilized the elbow pretty well. You've given him some relief to shoulder pain, not so great. He still has motion in that shoulder, but he really doesn't have any motion in the elbow except for turning his hand a little bit. So it's a pretty good splint. And you can also keep putting your ice on. And you can also elevate this if you want to. That will help. So the ice and the splinting and elevation. That's basic sprain care. Well, as with any injury, give this splinting and icing a few days. If your child is not getting better, please take them to the doctor. Let's make sure this is not a serious injury. So you can see with a few basic materials, splinting your child's next injury should be easy. If you think your child could have a serious injury, however, or after splinting for a few days, they're not getting better, make sure you check with that wonderful person you call your child's pediatrician. Until next time.